Congresswoman Biggert?
No, she's out of the office today.
Okay. We'd like to speak with her about healthcare reform.
Okay.
Could you have her come to the office?
Let me get our scheduler.
I would have to try and set that up.
Okay, well maybe you can. Yeah, why don't you have her, see if she can call us right now, and then we can talk to her.
Well, I don't believe she. I would have to try and check this out. But
Well, what is she
why
doing?
don't we?
Yeah, why don't you go ahead and check it out?
Well, how about you guys give me a chance to do
Yeah,
so?
sure, go ahead. Yeah, absolutely, absolutely. We appreciate it. Thank you. All right.
Okay, please sit down and start calling, okay?
So we need to be really professional. Can you see the...
Till the 12th of never, and that's a long, long time.
In the last 15 years, 11,000 Illinoisans have died because they don't have health care reform. 11,000 Illinoisans have died because they don't have health care reform. There's enough playing politics, right? Yeah, enough is enough. Get it done, right? It's time for her to get it done and to stop stalling.
Stop stalling.
The cost of doing nothing is far too high, and we are here as constituents. You are constituents
Yes,
to be heard. This is a matter of life and death.
I can't
Isn't
believe
it?
Congresswoman Biggert would play politics with an issue like this when people are dying. I didn't put Judy Biggert into office as one of her constituents, actually somebody who's campaigned for Congresswoman Biggert, for her to play politics with an issue. In fact, she ran for the people of this district. Now, Congresswoman Biggert, I didn't put you in this office to play politics with our health care. Please, Congresswoman Biggert, do the right thing. I helped put you into office to help the people of Illinois. Please, don't let us down. This is why we put you here, is to help our health care and not play politics with our health care. Thank you, Congressman Biggert, for all the good work you do in our district. Don't play politics with our health care, though. Please, do the right thing. For all the people of Illinois, get it done right now.
Get it done now.
It's a human issue. No person in this country should be without health care. I am 59 years old, been unemployed, and I cannot get health care to do maintenance, to prevent anything from happening. I'm too young for Medicare. This is a travesty. I've worked since I was 14 years old, and here I stand without being able to get... I'm afraid to even go out when it's icy for fear of falling and breaking an ankle or something, because I do not have health insurance. I could not afford it. It would be devastating. And it could eventually cost my life.
I know many good people who do have insurance and do pay their premiums, but they still can't go to the doctor because their coverage is so poor.
Okay.
So, unless you were invited,
Okay.
you have to leave.
Well, we're just here to see Congresswoman Biggert.
She's not available, is she?
Well, they're actually looking into it right now. They're actually looking to see if she's...
I don't think she's in town.
Well, no, but they're actually looking to see if she can talk with us right now, actually. So, I mean, they're actually calling her right
You
now.
have to leave. This is our building, and you're not invited.
Well, my understanding is that this is the
Congresswoman's
Congresswoman
office.
Biggert's building, which is paid for
No.
by tax dollars.
This
No.
office is paid for by our dollars. Doesn't she pay rent?
I have to call the police. Okay?
Wait, listen, all we'll do is we'll just have a statement. Okay? All right. Who wants to tell their story? Okay, well, what we're going to do is, Nabila, could you tell your story to Ben?
Actually, could I speak with you?
We're actually on our way out now.
Oh, you're heading out?
Yeah,
Okay.
we're on our way out. So
Well, they
we're-
kicked us out, Jonathan.
So we're going to be heading out. But what we would like simply...
Did you get Brian's card?
No. So we're on our way out, but what we would like to do, if it's okay, is just to have a couple people share their story with you. Is that all right? We'll start
I've
meeting
actually
right now.
heard from many of you, and Judy has too.
Okay.
But
Well, I don't know about that.
well, that is the case. But
Heard from me.
well, Brian, you've met.
Or you go ahead. Okay, go ahead.
My shoes are children's shoes, and they represent a child who will lose her mother because she doesn't have health care.
my shoes are for my nephew who has diabetes and a pre-existing condition and won't be able to get health care.
My shoes are for the people who do have insurance and they pay their premiums, but they still can't afford health care because their coverage is so poor.
This is my husband's shoe that he still wears, that he likes, and he's sent me with it because people are coming in and committing insurance fraud every day. Patients who had insurance and lost it in this long and deep recession. It's a shame. It's a terrible shame.
The shoe I left was Mike Kaepernick's shoe. He passed away. He had cancer and he didn't have health insurance. And the other shoe is my mother's shoe. She has a pre-existing condition and I can't get health care for her. Get it done now. We should be a country that cares about and takes care of each other. Thank you.
I put shoes here representing my children. I have children in their 20s and early 30s who cannot get jobs with insurance through no fault of their own. They've gotten education. They've jumped through the hoops that are supposed to make them middle class, and they can't get jobs with education. They're shut out of the system. And I think we need to get it done now. We need to have a public option for insurance for people who are being excluded or for young people who cannot get jobs that provide them with benefits.
These are shoes for people that don't have to go through what my mother went through. She had metastatic cancer, could never get covered by health insurance because my father owned a small business. It was too unaffordable. And I don't want anyone to go through what we went through. And this is my daughter's friend's shoes. Her mom has cancer and they don't have any health insurance.
Well, I would like to tell my story. I'm Cheryl, and I'm a constituent of Representative Biggert. I am very fortunate because I am over 65 and I have Medicare and I can afford supplemental insurance. So 2 years ago, when I found that I had breast cancer, I had the Medicare to cover 2 surgeries, chemotherapy, 3 more surgeries for reconstruction, and it was all covered by my Medicare and my supplemental insurance. Unfortunately, though, I met people at my cancer support groups who were younger. They had to worry about their jobs. They had to worry about losing their health insurance and that on top of cancer. I can't believe that in this civilized country we can't have a better health care system. Please, Representative Biggert, please vote for this reform. After all these years, we need to get it done.